So you mentioned that the techniques that you use allow for less infections.
Sure.
So briefly, 'cause I know we'll get into it more, but what are some of those techniques that you use that allows a patient maybe to walk away without the fear of an infection?
All right, so it's a few things. For example, I like to clean the skin of my patients myself. Back in the day, we used to say to patients to go home and scrub their skin with a chlorhexidine brush, and
Right.
then they would put on their regular clothes, and what would be the point of scrubbing it with a sterilizing brush?
When you're putting back the clothes on,
Right.
right?
So we have these high standards for cleaning our own skin, surgeons. But then when it comes to patients, the standards are, I think, are kind of low. You know, you can just use this betadine paint, and you paint the skin with betadine, and that's supposedly good enough. So I'll, instead of just using betadine, I'll use a betadine scrub on the skin. Then I use alcohol. Then I use a different kind of betadine, then more alcohol. And then I also use chlorhexidine. I mean, I know it's 3 times.
It's a triple wash of safety.
Right. Look, it's a little OCD, but what's the downside? The downside of washing too much is nothing. But the upside is potentially avoiding an infection.
Absolutely.
Instead of exposing the skin during surgery, we cover the skin with this thing called an Ioban. It's like this big, it's like a saran wrap.
Okay.
This way, once you make the incision, the only thing that's exposed are the edges of the skin right at the incision site. So let's say you have this big field and you have a bacteria sitting and waiting to get picked up and sent into the wound. There's a big sticker that goes on top of that. That will limit that chance. Antibiotics, that's a big deal.
Right.
So historically, and for many years now, the orthopedic community has been giving patients ANSAF, which is a cephalosporin, a type of antibiotic that's good for staphylococcus and streptococcus, which are the most common causes of infection.
Right.
The problem is that in Miami, and in general in big cities, about half of staphylococcus is resistant to ANSAF. And it's surprising why there aren't more infections.
Right.
Because if you give ANSAF to somebody who has MRSA, which is staphylococcus that's resistant to that antibiotic, then theoretically they're going into surgery with no antibiotic. So there is some great evidence now that a much stronger antibiotic called vancomycin, which is a big gun when it comes to bacteria, is better. So I'll give the patients ANSAF, like, to follow the standards. In fact,
Before the surgery.
Right.
Okay.
In fact, I'll give them instead of 2 or 3 doses, and then I will also give them vancomycin. And then if that wouldn't be enough, I also put vancomycin powder in the wound. And the studies on using vancomycin powder are very optimistic
Right.
in really avoiding infections.
You cover all your bases. I like that.